Good morning. I'm Matt Schwartz, chair of the Mayor's Healthy Hometown Worksite Wellness Committee, and I'm here this morning with Dr. Deborah Ballard, and she's with Norton Healthcare, very involved in their wellness program. We just finished up a program with CEOs and other leaders talking about the role of leadership in wellness. So, Dr. Ballard, I want to ask you a couple of questions about some of the things you shared this morning. First, just if you would just describe the basic approach. What are you all doing at Norton's?
Well, at Norton Healthcare, we are working to involve all of our employees by using our senior leadership to model the program. We're also working to work with our direct managers to encourage health and wellness. Our plan is tied to actionable items like doing a health risk assessment, seeing a physician, having specific attainment goals for health, and then also creating a supportive culture and environment with food and fitness and stress reduction. So we're trying to really give a very holistic approach.
And I know when we talked, you all you had to start at some point.
Right.
So what was the starting point?
The starting point really was just to introduce the idea in the culture, to do some basic education, to start with some fairly gentle, soft programs that introduce the concept to people. And then we progressively began to tie the activities around health to incentives. So now, engaging in our health and wellness program will earn you pay credits. So each pay period you get money if you're participating in the plan. Now, what you need to do to get those credits is going to become progressively more involved as we go through the program. So for this year, all we had to do was take a health risk assessment and see a primary care physician. Next year, we will add on a declaration statement around smoking and stating that you must try to stop smoking to get your credits. And then also that you've had your recommended cancer screenings. And then the other one is that you will engage in specific wellness activities like joining a gym, a fitness program, lose a certain amount of weight. So again, really tying the incentives to specific goals now.
So I know we had Russ Cox, who's one of your senior leaders at Norton's. Tell me about his involvement, or the other senior leaders. What was the impact, or what did they do to be involved?
Russ has been extremely supportive of our In Good Health program and has provided us with a lot of the resources that we need to make a strong program. He's provided us with a wonderful online risk assessment tool that Norton Healthcare invested in so that all the employees can have easy access to it. Russ has been out in front in videos, which we have shown to our employees. He's participated in walks. He talks about it at our leadership meetings. So he has really, modeled, and he also models the behavior himself, which is extremely important.
Absolutely. So what are the 2 or 3 things that you think right now is making your program successful? And why is it working?
Well, I think the things that are working best have to do with, again, the incentive structure in terms of people understanding if you do these things, you're going to get money back on your paycheck to help offset the increasing cost of our health plan. This is a very strong motivator for people. I think part of the other thing which has been very successful is an infusion through our culture of this whole concept, and trying to work through wellness champions within our organization who, again, go out to their colleagues and model the behavior. We've also worked hard to put in structural changes in terms of offering healthier food, making it easier for our employees to exercise. And so I think it takes the whole approach. One single thing usually won't get it. Obviously, people respond most immediately to money and things that hit them in the wallet. So that's very important that employees understand these health and wellness activities, they are good for you, and you're going to feel better, and you're going to have a better quality of life. But sometimes to get motivated to act immediately, you need to have an incentive that is immediately in front of them.
Right.
And that can be a credit on their paycheck.
So what would if you had one piece of advice, somebody who's watching right now does not currently have a program, leadership may not have actually taken the steps they need to, what would you recommend with regard to their leadership? So what should they be doing as a leader?
Well, the leader, first of all, really needs to believe in health and wellness and understand what it can do for their business. It is true that really is a business issue. And although it is not a short-term return on investment, long-term it is. And if any leader could just sit back and think, what would my company look like if all my employees were healthy, well, low-stress people? What would that do to my healthcare costs? What would that do for my productivity and engagement? Then they would go, this is good business. And then, again, model the behavior themselves. People are humans. They need that human interaction and touch and motivation. So seeing your leader live it and act it is very powerful.
Well, thank you. This has been great. We really appreciate the participation of Norton Healthcare. Dr. Ballard, thank you very much. And we hope to see you at one of our next programs. We have, once a quarter, we have CEO and leader roundtables, and twice every quarter we have get-togethers with HR and wellness champions. So we look forward to seeing you at one of our next sessions.